Hi, my name is Kelly Owens. I'm the Workforce Manager for AHI. I will speak to you about workforce implementation planning, but first I'd like to turn it over to Mike Lee, who's the Chief Human Resources Officer for Adirondack Health and has served a great leadership role in our Workforce Committee, who will share some information about the workforce structure.
Thank you, Kelly. We couldn't do the Workforce Committee without Kelly. I have to say she's our cheerleader, she's our go-to person, she keeps us on task, and she has a propensity for being able to recruit people, for which we're grateful.
Yes.
She should be in Human Resources, by the way. The Workforce Committee started planning early in 2015. And early in 2015, everyone was wondering, what does DSRIP mean? Fortunately, we now know what the acronym means, so we've made a lot of progress since early 2015. Invitations were sent out to approximately 250 participants, those who had met in 2014, to discuss human resources and workforce challenges in the Adirondacks during the meetings of the Right Professionals in Right Places, or RP2. Approximately 60 individuals determined or responded and said they would participate. I was asked to be the Workforce Committee Chair by Megan Murphy and Kelly, and I said, you know, I'm very busy. And they said, you and everybody else. So anyway, they did, I said, well, tell me what it means and what it is going to mean to the Northern Adirondacks. And I'm sorry, I'm coming down with a cold, so my voice will come and go a little bit. So anyway, we had two meetings, face-to-face meetings. Our first meeting was in Plattsburgh in June, and our second meeting was just recently in Lake Placid. And we have, right now, I believe we have over 99 individuals that are participating in the workforce committees. And the individuals that are participating are from a wide variety of organizations: hospitals, primary care, hospice, palliative care programs, long-term care, home health services, emergency services, unions. I think we have 3 unions now. We were just able to get the 3rd union participant in, training and education programs, membership organizations, and government agencies. Right now, we're moving to the implementation phase, and we have started with 3 basic committees in the workforce committees. One, compensation and benefits; the second, employee engagement; and the third is training resources. So a call was put out after our first meeting to try to get chairs for these committees, and these committees are really doing the legwork, the planning, the implementation of the whole plan. So they really deserve all the credit, as does Kelly, for keeping everybody else on track. But I'd like to recognize the 3 committee chairs. The first committee chair is Sadie Spada, CEO of Adirondack ARC, and she's in charge of compensation and benefits work group. The next is Diane Wildy, Dean of Special Administration Services at SUNY Adirondack, and she's the leader of Training and Resources Work Group. And Michelle LeBeau, who's not able to be here today and is the Vice President of Human Resources at CVPH, is the leader for the Employee Engagement Work Group. Oh, it's right up here in front of me. And then we've developed a new work group that was just sort of announced recently, Recruitment and Retention Work Group. And an email went out to seek participants. And so we'll be naming some leaders or co-leaders shortly. And I want to thank Kelly again for keeping us all on task and doing an excellent job of communication. She's going to give some updates to the work groups, but before we do that, I was wondering if everybody that's part of one of the work group committees could stand so we could see how many people are here.
I know there's a few of you here.
I know I've seen quite a few. Okay. So we don't have all 99 or 100 plus, but we have a good representation. Thank you.
All right, thank you, Mike. At this point, I'll give you a brief overview of what the work groups have been working on. And as Mike mentioned, the recruitment and retention group was just created fairly recently, and an email went out earlier this week. In meeting with all the work groups and also meeting with organizations regarding recruitment and retention, particularly related to behavioral health, to home health care, and primary care, we realized we really needed one team that was devoted to recruitment and retention. So based on that, and a call for membership was put out this week, and I'm glad to say within hours, we had about 9 or 10 people who were interested. And in addition to that, we also have a few folks who are interested in being a leader. So we're hopeful to identify a leader or co-leaders shortly, with the first meeting to begin in early November is what we're anticipating. The other 3 work groups have been very busy. The compensation and benefits work group is tasked with developing a comprehensive compensation and benefits work plan, understanding the impact for those who might be retrained or redeployed. The group has been meeting monthly since May. Typically, I think all groups have started meeting at the end of May at this point. And the group has been working to comply with a lot of the antitrust rules related to compensation and benefits. One was to ensure that all data gathered was compiled by a third party. So we're working on that. And we're also, the second issue that came up was that all data must be 90 days old, which we were not aware of at the time. And fortunately, we had a few members who were aware of that and brought that to our attention. Some PPSs are looking at an option to collect the data now and then age it out for 90 days. Some PPSs are looking at collecting data that is already aged. So if we send a survey out on November 1st, we'll gather data from August 1st. Upon discussion in our group, the group felt that perhaps gathering the data that's already aged will be ready to hit the ground running when we're able to complete the analysis. We have postponed the meeting for October at this point. There's a statewide meeting planned related to compensation and benefits amongst the PPSs, several PPSs throughout the state, including the Center for Health Workforce Studies, I believe Haney's, some of the unions are involved as well. We're hoping that we'll have more information on what the state is looking to gather, and hopefully we can ensure that all the PPSs are gathering the same information so we can evaluate it, across the state. The employee engagement work group, again, has been meeting monthly since May, has been tasked with engaging the workforce on DSRIP-related information and developing a plan to work with individuals who may be impacted by the implementation of DSRIP. We began reviewing some preliminary information to try to educate individuals on what DSRIP is and try to use tools that were already created, if there were any out there, that really brought DSRIP into easy to understand terms, which has been extremely difficult for all those of us who've been trying to understand what DSRIP really is. So we're working on that. We do have a draft that just gives high-level overview of what DSRIP is, and what we're feeling is it'll be a phased approach that we'll have the initial phase out with communication about DSRIP in general, and then provide information on what the projects are in very simple, basic terms in the future. We're hoping to identify within each organization a communication contact, and that person will be responsible for disseminating all of the information related to DSRIP to their employees. We felt that each contact within the organization would know the best route to communicate to their employees, whether it's an employee newsletter, a flyer with paychecks, a town hall meeting, if there's an employee blog, things like that. We'll use them to get this information to their employees. And the group will continue to develop a plan related to engaging employees who might be impacted by project implementation. The training resources work group is tasked with developing a training strategy for successful implementation of DSRIP-related projects. The group has updated a resource directory providing information on all education programs in our region for 2-year programs, 4-year programs, certificate programs, and master's level programs. In addition, they've updated a funding resource as well for opportunities to provide funding for that type of training and education. We also know that there's a lot of training that's going on in each of the individual organizations, and we wanted to know more about it. So we did have a group that met to develop a current training survey. We want to know what type of training is already occurring, and if it might be an impact to DSRIP, how we might be able to utilize those services. We tried to make it easy and simple to fill out. We know that you're very busy and getting a lot of surveys, so we have drop-down boxes to try to identify if the training is offered, if the training is required or optional for your employees, how often the training occurs, and then if you have an in-house trainer or if you brought in a consultant to provide the training. We also want to gather information about training that you feel is important, that you'd like to have within your organization or you're planning to have within your organization. The other component, which, and again, this is draft, we'd like to find out what training may have already occurred that might not be encapsulated here, that might be DSRIP related, that we might be able to utilize in other organizations as well as the projects progress. Again, each organization will be asked for a contact related to training so that we can forward the survey to that individual. All of the meeting overview notes, I believe from October on, will be posted online as well. So if you wanted to check the AHI PPS website, you'll find information on what was the kind of a meeting overview notes for each of the individual meetings. Okay, there are a number of key workforce components that we are charged to report to the Department of Health. One of the biggest issues has been the changing timelines. There's been a lot of changes related to the workforce implementation plan, and as Colleen indicated, quarterly reports were due for every other project and plan, all 19 others, back in August, except for workforce. We found out shortly before, a couple weeks before, that they were delaying the workforce implementation plan submission. So that will actually be submitted in October 31st, which will be here before we know it. The first component is the workforce engagement and communication plan. This is the workforce activity is actually part of the governance plan, but it is something that's a workforce deliverable. So we are reporting on the governance implementation plan related to that. The employee engagement work group has been very active in working on mechanisms to communicate with all levels of the workforce, and a formal communication plan on communicating to workforce is due by March 31st of 2016. The next 5 steps really require high-level assessment, complex and comprehensive assessments, and in order to complete in the best way possible and to make sure we're gathering all the information we're going to need in a very reliable manner and not coming back to you for more questions and more surveys, we're in discussions with the Center for Health Workforce Studies to assist us in completing these analyses and surveys that might be sent out to you. The first is the current state assessment. So in order to figure out how to get to where we need to be, we have to know where we are now. So the Center for Health Workforce Studies, we're hoping will help us in that assessment. DOH has just provided some updates with the occupations that we need to track. There are 74, and there is a caveat that we could include other occupations as well if we find that that's if there happens to be one that has been missed on this particular list. They've also given guidelines on the facility types, 9 facility types that we're supposed to be tracking this information. And if there is an organization that's missed on this, we're hoping to catch that within the current state assessment. The current state assessment will be, we're hoping will be a fillable PDF that would be sent to an identified contact within each organization, assuming it would be someone in human resources. The information that's received from this particular assessment is crucial to all the workforce planning moving forward, so that will be a requirement for all partner organizations that we have this current assessment completed. What we're hoping to do, again, to try to not burden organizations with surveys, over surveys, is try to combine this with the compensation and benefits analysis, if time allows. There have been some delays related to that, so we're going to keep our fingers crossed that we can kind of keep everything together. But on this particular form, you'll see we've got the number of employees, the FTEs, total annual separation, We've also discussed the possibility of including the number of vacancies when this particular form is completed. We feel, probably particularly for the recruitment and retention work group, the number of vacancies is going to be important to consider along with the total annual separations to identify retention issues as well. We also would like to get a better understanding of the care coordination workforce in the region. We feel that the care coordinators or care managers are going to be a very important part of the success of DSRIP. And there are many job titles. We have care coordinators, care managers, case managers, patient navigators, consumer advocates, resource advocates, with varying degrees of background. We'll have LPNs, we have RNs, we have MSWs, and we have BSWs. So we want to get a better idea of the care coordination workforce and be able to share that with the projects as well as our partner organizations to hopefully plan accordingly as you're moving forward with project implementation. Our next step is the future state assessment, and the future state assessment shares information on the future demand of the healthcare workforce based on anticipated needs of project implementation. There are a couple ways to do this. One way is surveying organizations again, and another is microsimulation, which analyzes information related to all the projects as well as taking into consideration the demographics of the regions that we encompass. So for instance, we know in a few years the Adirondack region is going to have one of the oldest populations in the country. So taking that into consideration as the project plans progress as well. The implementation due date for the future state assessment is March 31st of 2016, and I forgot to mention, as is the current state assessment, is due March of 2016. And that brings us to our gap analysis, where we'll take the information from the current state assessment and the future state assessment and identify the gaps and where we need to be by the year 2020. This information will also help us build a roadmap of the steps that we need to take to get to where we need to be. This is also due March 31st. However, we know that we cannot have everything done on March 31st. So ideally, we'd like to have the current and future state done December through February, early February, so that we can have a gap analysis complete and complete that roadmap so we know how to get to where we need to be. The compensation and benefits analysis has probably been the most fluid milestone within the workforce implementation plan. Originally, it was due December 31st. Then it moved to March 31st about 4 weeks ago. And 2 weeks ago, it moved out to June 30th of 2016. Originally, it was to be an annual, originally it was to be a one-time achievement. Now it's been changed to an annual achievement. So we're hoping to get more information related to what the state is actually looking for. There is a statewide meeting being convened in New York City, October 13th and October 23rd. After those meetings, we're hoping to get a better understanding of what they're looking for within the compensation and benefit analysis, especially as it relates to full or partial payments, or placements, excuse me. A full placement would be someone making 95% or higher of what they were making in a different position, and partial placements would be individuals who are making anywhere from 75% to 95% of what they were making in another position. And the last milestone is the training strategy. The roadmap that's developed with the gap analysis is really going to drive our training strategy. So we need all that information so we can identify what the training needs are within our PPS to get to where we need to be in 2020. This is also due March 31st. So we do have some concerns related to that. We're hopeful that perhaps as some of these statewide organizations are meeting, the statewide workforce work group is meeting. It has individuals from the AHACs, from the Center for Health Workforce Studies, from Iroquois, from 1199, from Haney's. We're hoping as they really map everything out, potentially we could extend that to June 30th. I think that would be ideal to give us an adequate amount of time. We'll have some information to work from if we have to submit something preliminarily, and then hopefully be able to revise that as we have more information that can be gathered. And that's it. Probably the only other thing I would add is that there is a lot of collaboration going on. We know for DSRIP to be successful, we need collaboration internally within the PPS as well as externally with other PPSs. And as Colleen mentioned, there has been collaboration with our neighboring PPSs and looking at ways with training. Can we bring training into a region and save on potential costs related to that? But also sharing our collective concerns related to compensation and benefits related issues potentially on how to, and bring that to DOH's attention and to see if changes might be able to be made with that.